live. No point. I don't think anyone's there. I should say Facebook/YouTube, because we're now live on Facebook, YouTube, and Instagram. So that is. Do you like the way I'm using the word "we"? As if I'm sort of, yeah. I think that's what happens when you get a little bit echelon, you know, when you get famous. Simone is here, and Simone, can I ask you a question, Simone? Is the audio working? Because I'm not saying that it often, I won't say often, but it has not worked in the past, and I only found out about 20 minutes in. So Simone, give me a sign. Show me a sign that the audio is working. Now that's a bad thing because Simone's not giving me a sign. Now I know if the audio is not working, she's not going to hear that. Oh yes, it is. Right, good. There you go. It is working. So that's what it is. Instagram, you're wondering what I'm doing. I'll tell you what I'm doing. I'm pointing to the bit at the bottom I've got on Facebook, because I'm not doing this straight onto Facebook. Oh no, I'm going through a third-party software where I can put stuff on the screen like that, because that's how the pros do it. Charlotte's in Cornwall. Hold on a minute. Terry, hello from sunny Cornwall. Charlotte, hey from Cornwall. What we're saying, we've got 2 Cornwall people. We've got 2 Cornwall people? Gutted I can't stick around too long as getting ready for a night shift. Charlotte, don't be gutted. Don't be gutted. There, I got it. Well, no, I shouldn't do myself down. It's going to be a very interesting evening, Charlotte, and there's a lot of questions tonight. I've got a lot of questions to get through, so I'm going to dive right in. Terry's on holiday. Whereabouts, Terry? Love a bit of Cornwall. Oh God, they're in trouble though, Cornwall, isn't it? You're not allowed to go to Cornwall because they've got so much COVID because of the whatever that festival was. But yeah, I mean, when the weather is good, you cannot beat Cornwall. Simple as that. Cannot beat it. Red Ruth. Red Ruth. On holiday in Red Ruth. Do people go on holiday to Red Ruth, Terry? Is that a holiday destination? Red Ruth. Obviously it is. Well, there you go. Red Ruth. I'm from Falmouth. Falmouth is how I choose to pronounce it. No one else does, but Falmouth. Saltash, nice. I'm gutted. I love your lives. You've helped so much with my questions before. There you go. You see, I can be helpful. Never heard of Red Ruth, people going to holiday on Red Ruth holiday. Charlotte, nor have I, but Terry is starting something here. Holiday destination. I'm sure the Red Ruth tourist board will be very unhappy about this conversation, because I'm sure Red Ruth has got a lot to offer. So, and Terry, you know, if you can just outline some of the bullet points of the Red Ruth destinations. If we're on holiday, got the kids, what can we do in Red Ruth, Terry? What can we do? Anyway, I guess you can go to other places, but there's probably loads to do in Red Ruth. Good base, yeah, good base for other places. That is a thing. Yeah, definitely. So good, absolutely. Well, Terry, I hope you're enjoying it. Yeah. Look, Aminé is straight in. She's not messing about. It's straight in with a YouTube. I don't know if you can tell. I can tell that that's a YouTube question. So not only is Instagram gone mental, you know, 2 people on Instagram, not only is Facebook gone mental, but YouTube now. Is there anywhere? I don't know where we're going to end this. Where's the ceiling for this? We got 2 people on Instagram. We've got Facebook like up to the gills, and we've now got YouTube. I mean, I don't know if the capacity can. The bandwidth is just unbelievable, the reach. But anyway, Aminé, thank you for the question. I'm going to ask you right now, Aminé, if prone to keloids, would massaging a tummy tuck scar make it worse? No, Aminé. Keloids is something really worrying, and if you're prone to keloids, it is a real worry. But obviously you've had your tummy tuck, so you've gone for it. But there's nothing you can do to prevent a keloid from coming if it's going to come, aside from not having surgery. So you've gone for it, you've had surgery. So what I would say is, let's be positive and let's hope a keloid doesn't come. So what I would say to you is just keep an eye out for keloids, keep an eye out to see if it starts getting raised and lumpy and itchy, and that would suggest that it's started to keloid, because then there's things whoever your surgeon can do to try and sort of arrest the development, which is things like silicone sheets, silicone gels, steroid injections. So there are things that can be done, but massaging is not going to make it become keloid. And actually, I think massage is good. I usually tell people to wait about 6 weeks before massaging personally, up to the surgeon. I think Jackie and Terry on Instagram would agree with me on that. There's one person on Instagram now, so that's probably Jackie. So there you go. Thanks. I'm sure Jackie would agree with me on that. Sometimes there is more people on Instagram, and it's early days, and that's okay. No, massaging is not going to make it worse, Amine. And if your surgeon's told you to massage it, go for it, and be positive, and just keep an eye out for keloids. If it comes, then get to talk to your surgeon, because there's stuff we can do, Jackie. Yeah, good on you, Jackie. Keeping the numbers up. You're keeping Instagram going, Jackie. You're keeping it alive. Oh God, nothing in red roof. There you go, Terry. But it is a upside down smiley face. Who knew that was a thing? Jane has joined Jackie. Nice to see you, Jane. Yeah, nothing in red roof, but it is a good base. Precious Tyra, how bad is the pain after breast implant surgery? Or hard? It's unbearable. No. Where'd you hear that from? No, it's not unbearable. Obviously, probably best to talk to someone who's had it done rather than me, because you might say, oh, he's got a vested interest. But it's not too bad. It feels tight. It feels weird. It feels uncomfortable. It depends on whether you have it in front of or behind the muscle, because that's the sort of main, I guess, marker of how bad the pain is going to be. It is more uncomfortable when it's behind the muscle than when it's above the muscle. So if you're having it above the muscle and you've heard from someone who had it under the muscle that it's unbearable, don't worry too much, because it might be that theirs was worse than yours will be. Having said that, I find that there's a sort of bell-shaped curve for pain with it sort of under the muscle, and then another bell-shaped curve with the pain for it over the muscle. And the curves overlap. So some people have it under the muscle and have not that much pain, and some people have it over the muscle and have a lot of pain. So it's not, it's not written in stone you can have pain if you have it under the muscle, but it is generally speaking more uncomfortable under the muscle. But even under the muscle, I think it's bearable. I wouldn't say it's unbearable. I think you can do things, and I don't know if anyone on the in the house has had breast implant surgery. I don't know if they want to divulge that, but if it was the pain unbearable, can we ask that question? Is that breaching some kind of thing? Maybe I'll keep it. Yeah, I'll keep it to me answering the questions rather than anyone else. But I would say it's not unbearable. It feels tight, uncomfortable in my experience, and people are just a bit uncomfortable and just want to take it easy for the first week or so. Charlotte, on your last live, I told you about the hole in my breast after my lift with implants. Yes, you did, Charlotte. A week later, the hole has gone. The breast is looking loads better. I finished the antibiotics tomorrow. I'm going for a checkup with my surgeon next month, so fingers crossed the infection never reaches the implant. Charlotte, that is, I didn't expect you to say that, Charlotte, and that is amazing, because it is such a worry, and I worry so much about these things when this sort of stuff happens with a breast lift with implants, because it's so worrying, the risk of infection getting to the implants, that I'll be honest with you, Charlotte, I was very worried. I don't know, I know you probably want to be reassured, and I perhaps wasn't very reassuring, because I was like thinking, oh my Lord, but that is absolutely amazing. So thank goodness for that, and well done. Amine, I've not had it done yet. Definitely good info, thank you. Yes, positive, Amine, positive. Charlotte, I had mine under the muscle. It was painful for the first day. Yeah, very limited with arm movements, I found. It only gets better though, just a shock to the system. Weird pain to describe. It definitely isn't unbearable. Yeah, I would agree with that. It feels weird, feels tight, but I wouldn't say unbearable. I would say that it's a bit sort of, definitely uncomfortable, but I wouldn't say it's unbearable. Precious. Thanks for the information. When can one expect what can one expect after surgery? If they have an outy belly button pre-surgery, would the scars be visible? Right, tummy tuck we're talking here, because I'm gonna link it with a previous question about the keloid. So yeah, if you've got an outy belly button, yeah, we can have a go at the belly button. Amine, always best to talk to your surgeon. You know that. Come on, Amine, this ain't your first rodeo. You know it's always best to talk to your surgeon. But in my view, unless I am your surgeon, if I am your surgeon, there, yeah, you're absolutely right to talk to me. But in my view, yeah, we can have a go at it. Have a go at making the outy innie during the surgery, definitely. And there will be scars. Well, I'm assuming you're talking about a full tummy tuck here, Amine, rather than a mini, because a mini tummy tuck, we don't do anything to the belly button, so it wouldn't be possible to do anything to the belly button with a mini. But certainly with a full tummy tuck, there'd be a scar around the belly button, and we could have a go at making it an innie. Faux show. Kel says, I had zero pain, literally didn't even take any pain relief. These were with overs. So there you go. Kel had zero pain. Charlotte had bad pain for 1 day, but hers was under. So yeah, I do think there is some degree of pain, and that just demonstrates it right there. 1 under, 1 over, pain for 1 day, but not too bad. Kel, zero pain. So thanks for that, Kel. Hope that's helpful, precious, for you. I'm going to get straight in with this question here. Can I have redo Mastopexy if I don't have the operation notes for the original? So I'll read the question in full, if that's okay, if you don't mind. I had masto. To be honest with you, the question said I had masto, no implants. I'm assuming that means Mastopexy, and it makes sense for the rest of the question. So let's just assume it, because masto, I don't know why, for me sort of suggests mastectomy, but clearly it's not a mastectomy, is it? It's Mastopexy. It wouldn't be masto, would it? It'd be mastay. Anyway, let's not split hairs. Let's call it Mastopexy. I had a Mastopexy, no implants, a couple of years ago, but got pregnant soon after and would like it redoing now that I know I won't have any more children. The only problem is the company I used went into liquidation and don't have any of the medical notes, so I don't know which technique was used in the surgery. Would you still be able to operate on me safely without knowing this info? This is a really good question. And this goes back to the fact that if you've had a mastopexy or a breast reduction, both of those operations involve lifting the breast and involve moving the nipple from a low place to a high place, and we have to isolate the nipple in order to move it. And we isolate it in different ways. So we keep it attached somehow. So you can keep it attached on we call it a pedicle, which is like the stalk that's attached. So you can have a superior pedicle, which means it's attached to the top. You can have an inferior pedicle, which means it stays attached to the bottom and you release everything from the top. You can have a superomedial pedicle. To be honest with you, those are the main ones I use, but you can have a lateral pedicle, a medial pedicle, a horizontal pedicle, a vertical pedicle, horizontal bipedicle, vertical bipedicle, all sorts. But superior, inferior, and superomedial are the main ones I use. But the point being, it's attached in certain areas, and you release all the tissue around the nipple, apart from the bit that you're keeping attached, which is how you keep the nipple alive with the blood supply and the nerve supply. The problem is if you have another operation, if you have another lift or another reduction, we need to use the same pedicle. If we've kept it attached superiorly and you have another one, you need to keep it attached to superior and release the lower tissue again, because if you keep it attached inferiorly, then you're basing that nipple on scar, and there's a worry the nipple can die. And I've seen it happen, both nipples dying for a revision where we didn't know the original. I wasn't the surgeon. It was when I was training. It was going back a bit because I'm getting on now. Nice grey hair, bald. Yeah, I know I'm getting on. Don't remind me. But anyway, it was when I was training, so back in the day. I mean, sometimes I feel like my face looks a bit like a lemon. I don't know what you think about that. Does it look a bit lemony? No? Anyway, so you need to know the original pedicle. So if you don't know the original pedicle, it does become difficult. Now, if it was, so the question is, can I safely have another Mastopexy? It's very hard for me to answer that without looking into the situation. Now, if it was a Mastopexy, that is better than if it was a breast reduction, because we don't isolate the nipple quite so much, and we would probably, or I would tend to use a superior pedicle when I'm doing a Mastopexy, because I want to take out the heaviness from the lower pole, and I release it from the lower pole and push it all up north. We might have an idea from when it was done. I don't think you say when it was done. And if it was done a very long time ago, even worst case, there's a risk, there's a chance there might be some blood supply going through, coming through the scar, but it would still be worrying. I've got to be honest with you, it'd be worrying, and I would probably limit the amount of undermining I did, limit the amount I would release the nipple, and I guess it would depend on how much of a Mastopexy you needed, how droopy your breasts are, basically, how far you have to move the nipple. The further you have to move the nipple, the more you have to undermine that and release it, and the more worried I'd be. But if it's only a little bit, I'd probably thinking I can keep the nipple attached and not undermine it too much. So I'm going to have to say it's going to be on a case-by-case basis, and it would have to be an assessment and weighing up the pros and cons. But definitely the risks increased. Fact, if you don't know the original pedicle, the risks are increased. Doesn't necessarily mean you couldn't have it done. It would need a discussion with the surgeon to have a look at how much of a lift you needed, have a look at what, if we can glean how much of a surgery you had previously, whether it was just a lift or if it was any degree of reduction. As I say, reduction would be more isolating to the nipple. So yeah, but it's not a no, it's a maybe. But we would be limited as to how much undermining we could do, and you would have higher risk. So that's a bit of a cop-out, but it's fact. What can I say? Rosalina with an O. After a tummy tuck and breast lift without implants, is it safe to start running after 8 weeks? Rosalina, do you remember what I said a minute ago about the surgeon thing? Talk to your surgeon is always best. Talk to your surgeon. Am I your surgeon? How long do you think after a tummy tuck and breast lift you can go on big roller coasters? Oh my God, it's getting worse. I'll tell you in general terms what I think, Rosalina, but the answer is the answer to the question is talk to your surgeon. I won't cop out of it completely, because I will give you my view on it, but I don't want you doing what I say, having a problem, and then going back to your surgeon and him saying, "Oh, you shouldn't have done that," and you saying some guy on the Instagram told me to. I say that around now, you're 8 weeks, I say people can start getting into stuff. A tummy tuck and a breast lift without implants is a big op. It's a big op. So you can start getting back into stuff. You can start. So in terms of running, start. The problem with running is the impact, isn't it? Boom, boom, boom. So start. Obviously, wear a supportive bra and start and see how you feel. If it's uncomfortable, if it hurts, so start gentle. Don't go on any big run that you've got to get back again. And you know, because often there's a bit of a delayed reaction. You go for a run and then that evening or the next day it hurts. So just start with gentle and sort of build up. So I would say, yes, you can start now, but talk to your surgeon, but just start gentle and build up. Number 2 question, roller coasters, same. I don't really know much about roller coasters, but same is a big, just see how you go with the running, Rosalina. And if the running's okay and you can build up the running, listen to your body. I don't think there's any answer about big roller coaster. You have a bar, don't you? Is that going to be uncomfortable? Do you want to go on a big roller coaster, Rosalina, 8 weeks post tummy tuck and breast lift? I'd say if it was me, I'd probably be a few months. I'm saying 3 months before I'd probably want to get into big roller coasters, because there's, like, you know, all that. But I don't know. I don't know if there's an answer for that. But you listen to your body. A lot of this, listen to some people like heal really well, and some people take a bit longer. But big roller coasters, gut feeling 3 months. But you know, see how you go. I am due to have tattoo excision with you. However, when I usually go to the dentist and they give me LA, local anesthetic, I get dizzy. Will I be okay for this procedure? Yeah, definitely. I mean, you might get dizzy again. I mean, it stings a bit, the local, and it makes you feel a bit dizzy. I've got to be honest, it hurts quite a lot with the dentist. I think it hurts worse with the dentist, because in your sort of gum and stuff. I think it's normal for people to get dizzy with that. But you might get dizzy, but you know, what's the option? GA, getting put to sleep, forget it. I won't go put to sleep for a tattoo. Well, I haven't seen it yet, unless it's a massive one. But no, I think you'll be absolutely fine. But you might get dizzy, but that's okay. I think people often get a bit dizzy when they have the local because it hurts, and they get a bit stressed out. So hopefully it'll be all right this time, though. Hopefully it'll be better than the dentist. I'm not 8 weeks yet, and I'm not going on a roller coaster yet. Don't worry. Just wondering if I can in November at 3 months. I've got to be honest, Rosalina, the answer is maybe. That sounds terrible, doesn't it? But yeah, I mean, as I say, my gut was 3 months. But if you're healing all right so far, take things, don't go crazy on it. And as I say, talk to your surgeon. But yeah, about 8 weeks, you can, I would say, start getting into things. So you can start maybe gently running and things. And if that works out, then yeah, you might well be okay at 3 months. But I think that's sort of like the lower end, or the earliest you'll be able to do things. But sounds like fun. Well, I say sounds like fun. I've never really been I've never been on a roller coaster. And it's not something on my list of things to do, to be honest with you. I can't understand why you'd want to go. Make you feel. I tell you, I went on one of those things that went up, and they went up in the air. I was just terrified. It didn't even go down fast. I think it went down slowly, but I was terrified just sitting there with the legs. I don't want to be terrified, but to each his own. So I know that roller coasters are a popular form of entertainment. So yeah, but yeah, should be fine. I would hope it'll be fine at 3 months. Thanks. I'll see how I feel. That's the answer. See how you feel. Absolutely. What are the risks for surgery? Bracket, open brackets, mummy makeover, close brackets. Risks for surgery. So mummy makeover is a big op. Let's not sugarcoat it. It's a big op. It covers a range of procedures, but broadly speaking, it's a tummy and a breast procedure is the sort of standard thing as what you would call a mummy makeover. And it is a big op, and it will knock you back, and there are risks associated with it. Most of the risks that people are talking about are the risks associated directly with the surgery. So the risks directly associated with the surgery are wound healing problems, infections. If you're having an implant, in terms of the breast procedure, if the infection gets to the implant, you have to remove the implant. Dog ears, asymmetries. Again, if there's an implant rippling. Longer term, there's problems like capsular contracture, so the implants can go hard. Again, quite a lot of it problems associated with implants. I don't know if you're having implants or not, but let's just assume you are for the purposes of the question. There's Alcl, which is a very rare cancer associated with implants. Yep, cancer. Hi JJ, looking great. Thank you. ALCL, breast implant illness. People with breast implants feel ill and have to have them removed. So there's all sorts of things that can go wrong. I've got to be honest, they're rare. All of those things I've just said are rare, but these are all risks associated with the specific surgery. Obviously, bruising and swelling and what have you is a sort of a risk, I guess, but it's usually short term. In terms of the general risks, then there are general risks with surgery, and they would be well, I wouldn't say obviously, because I don't think any of this obvious is problems with what's the word, allergy or sort of reaction to the anesthetic. Again, very rare. And the big one that I worry about with any surgery, but particularly long surgery and particularly tummy tuck, is DVT. DVT and PE. DVT is a clot in your leg. PE is when it flies off into your lungs. That's a big deal. So that is a risk, because that is a big deal. Again, very rare, never happened to me, but still, it's definitely out there. So that is something that we need to be aware of, and therefore we need to, the best thing you can do is move, basically. There's lots of things we do to reduce the risk, stockings and boots and heparin and stuff, but the best thing is to move. But yeah, that's probably the big one I would probably think of in terms of the general one. So yeah, not a small list there. Yeah, mummy makeover has got risks. So something's happened here. I love roller coaster. Just booked wing walking for next year. Rosalina, go for it. Wing walk. I can't. It's like parachute jump. I mean, it's like bungee jump. You'd be so stressed. I find it so. I would imagine you're so stressed on the way there. You might say afterward it's great, but it's just not worth it for the stress on the way. So I'm like, no, thank you. Sorry, safety and beauty. Do certain implants carry a higher risk? Yes, safety and beauty, they do. So the problem, maybe not a problem, but the issue with implants, there's different types of implants. And broadly speaking, well, there's saline and silicone. So there's two different types of content, saline and silicone in terms of the content. And then there's different coating around the outside. So they've all got a silicone shell, but some of them are smooth, some of them are rough, and there's different grades of roughness. So there's a little bit rough and there's more rough. And then there's polyurethane foam, which have got a foam coating around the outside, which is very rough. So they range from very smooth to very rough. And the issue is that there's different risks with each of them, because you might say, well, I want the ones with the least risk, please. Now, if one had less risk, then we just use that one. So the thing is, one's got less risk of something, and then the other's got less risk of other thing. And just sort of broadly speaking, one of the issues is capsular contracture, scar tissue forming around the implant. And the smooth ones, the scar tissue forms around the implant and goes hard more quickly than the rough ones. The rough ones, the scar tissue is broken up by the roughness. So when it contracts in all different directions. So the foam ones are very last a lot longer and a lot less likely to go hard than the smooth ones. And then the other one, there's ones in between which are a little bit rough, which are in between. So that's the good things about the rough ones, that they go hard a lot later than the smooth ones. The problem is that the smooth ones have got there's this ALCL, very rare, but it's a cancer associated with implants, and we think it's related to the roughness. So the smooth ones don't really get ALCL, whereas the rough ones do. And the progressively rougher it is, the more risk of ALCL. The progressively smoother it is, the more risk of it going hard. So it's a bit like, you know, there's no one best one, but there are different risks with different implants. Maybe I should have just said yes, there are different risks. With straight-in, with more. Is it a legal requirement for a cosmetic surgeon? Oh, to be on, two-part question, to be on the specialist register on the GMC in the UK to carry out any cosmetic surgery procedure? That's a good question. Safety and Beauty Awards. And I've got to be honest with you, I could talk about that. You know what, Safety and Beauty Awards? I could write a book about this. Hold on a minute. I've written a book about it. So no is the answer. There's no legal requirement to be on the specialist register. And the problem, oh, Jesus, sorry, I swear live on TV then, sorry if there's any children watching. There shouldn't be any children watching, should it? No, it's not, right, I'll clear that up. It's not a legal requirement, safety and beauty. And the issue is that cosmetic surgery is not a surgical specialty. When you get on the specialist register, so what we're talking about here is GMC, General Medical Council. All doctors are registered with the GMC. That's, if your doctor's not registered with the GMC, then you're in trouble, because they can't prescribe drugs, and you know, that's so all doctors basically are on the GMC. But the GMC have what's called a specialist register, and a specialist register is for people who've done an extra period of training. So one of the things I talk about is having a fully trained surgeon, and everyone assumes that all surgeons are fully trained, but they're not. So you need to be on specialist register in order to prove that you're a fully trained surgeon. All surgeons in the NHS, or at least all consultants in the NHS, will be fully trained. But in the private sector, there are people who are doing surgery who aren't fully trained, who aren't on the specialist register. And when you're on the specialist register, you're on the specialist register for a thing, for a specialty in surgery. And plastic surgery is a specialty in surgery. ENT surgery, general surgery, orthopedic surgery, brain surgery, cardiothoracic surgery. So there are certain maxillofacial surgery. There are certain specialties in surgery. Cosmetic surgery is not one of them. So cosmetic surgeon is not really recognized by the Royal College of Surgeons. Plastic surgeon is. So the people who can say I am a plastic surgeon, I have got a fellowship in plastic surgery, and I am on the specialist register with the GMC as a fully trained plastic surgeon. And you can tell those people because they've got FRCS plast in brackets. So if you're on the specialist register, you'll have plast, or if you're an orthopedic surgeon, or ORL if you're an ENT surgeon, otorhinolaryngology, or gen if you're a general surgeon, or whatever. But the point is, there's no legal requirement for anyone basically to do anything. So you can still do surgery on people even if you're not on the specialist register. So forget being on the specialist register for, well, as I say, there's no specialist register for cosmetic surgery. Please send us a copy of the cover of your book. What about a copy of the book? People need much more awareness. Well, Safety and Beauty, if you're in Birmingham, come to my clinic and I'll give you a copy of my book. If you're not in Birmingham, I'll send it to you. Go to neveracceptaliftfromstrangers.com, or is it .co.uk? I might be both. But anyway, and you can get a copy, $3.99, and I'll send you a copy. That's for the postage and packaging. $12.99 on Amazon, but $3.99 postage and package on my website. But if, as I say, if you're in Edgbaston or in Birmingham, pop into the clinic and we will give you one, because I want to get the message out there and I want to get them out there. So yes. So yeah, that is the issue. So the bottom line is anyone can do surgery without being a specialist surgeon at all. So the onus at the moment is on the patient to do the research to find out who is trained and who isn't trained and who has got qualifications. And unfortunately, all sorts of people are getting into it and doing surgery and then finding out that their surgeon wasn't trained. And it is not because it's cheap, because there's people who are actually quite expensive who are perhaps not fully trained. There's some high profile cases. The equivalent of being fully trained in America is board certified. They call it board certified. And Kanye West's mum, Donda West, she was his manager, and she had surgery and she died under surgery, which can happen to anyone, but her surgeon was not a fully trained plastic surgeon. And that was obviously money wasn't an issue there. So that was, pretty shocking. And Usher's wife had liposuction. I think she had a DVT, but her surgeon wasn't board certified. And the other one is it Colin Henry? Colin Henry, is that the footballer? Played for Scotland. I think he might play for England. Anyway, there's a Premier League footballer. His wife died having had liposuction to her abdomen, and again, her surgeon wasn't even trained surgeon in anything. I think he was a GP from somewhere. So yeah, it's happening, and there's no law against it, unfortunately. It is happening, and at the moment, the onus is on the patient to ask questions about training, etc. And unfortunately, people just assume that if there's a nice clinic and it's looks good, then the surgeon's going to be trained. But there you go. That's what we're up against. Continue to fight the fight. Keep up your work. Thank you. Love you too. Right, what's going on Facebook? I know I've ignored your Facebook, but Safety and Beauty Awards has been talking to me. Right. Zoe Fisher, after losing 7 stone, I still have side boobs that I want gone. Also need an armpit lift and breast lift. So I'm thinking the side boob can be incorporated with either arm lift or breast lift. Which will be the best to combine within your opinion? Thank you. Very nice question, Zoe. So yeah, I mean, this is something you'll probably need an assessment with the surgeon, I would suggest. But yes, what you say can be done. So what we're talking about is this fullness here. And you could, depends on how bad it is, depends on how much skin there is. I find this area does respond well to liposuction. The good thing about liposuction is it doesn't give any scars. So if the fullness isn't too bad, then liposuction can be done at the time of the arm lift or the breast lift or whatever, if it's combined. But if there's a lot of skin there, and you've lost a fair amount there, 7 stone, you can carry on the arm lift and extend it down to cut that skin out. Now, it does give a scar. I mean, the problem with an arm lift is a scar. So it does give a scar, which can be unsightly. But and more risks because there's a scar and wound healing problems, etc. So you know that will be you'd either look at liposuction if you feel the skin's going to recoil, and I find the skin does recoil quite well there, but if there's an awful lot of excess skin, then you can cut it out and sort of continue the arm lift down. Yeah, needs assessment, I guess. Zoe, Tracy, first one of the evening to use the hashtag AskJJ. Not telling tales on anyone, but you know, there has been quite a few questions and there hasn't been any hashtag AskJJs. We've got to get this trending, guys. You know, we've got to get better at this. You know, can you have a word with yourself, reflect on what you've done, and just try and, you know, get that hashtag AskJJ in. Thank you, Tracy, for bringing that front and center. Hashtag AskJJ. Evening, JJ. How are you doing? Clap, I think that is, and Sidehouse. Good to see you. Can everyone get good upper pole fullness result with breast implants? Wow, that's a big question. That is a big question. That's an interesting question, and it's an interesting question because you know, people are polarized in terms of the upper pole fullness. Upper pole fullness is obviously well, I wouldn't say obviously, but it is a thing that people often want when they're having implants. So the upper pole is from the nipple up, but some people are a bit cautious about it and don't want too much upper pole fullness and are worried that that upper pole fullness will look fake, but they want some upper pole fullness. Now, if you want to focus on the upper pole fullness and you want to have that more fake, if you like, look and that fuller look in the upper pole, I think this is where your question is going. Actually, sometimes it can be difficult to get a lot of upper pole fullness. In a way, it's easy to not get much upper pole fullness because you just use a lower profile implant. You use a lower profile or a teardrop implant to get less upper pole fullness. But actually, if you want a lot of upper pole fullness, particularly if you want the more fake look, it can be difficult if you've got quite a bit of breast tissue of your own. So if you've got your own breast tissue, that will tend to be on top of the implant and that will soften that look. So if you do want a very rounded look, if you haven't got much breast tissue, yes, you can do that by using an extra high profile round implant, and that can look quite rounded and sort of dome shaped if you want that sort of look. But if you want that look and you've got a fair bit of breast tissue already, it can be more difficult. I don't know. I'm guessing that's where you're going on that. So everyone can't get good upper pole volume result, I guess, if you want that big sort of fullness up here. Often an extra high profile implant can be softened if the patient's got a fair bit of breast volume of their own, particularly if that's sitting a bit low, which it often is. If you've got a bigger breast, it is often sitting a bit low, and that extra high profile can balance it and actually give a more natural result, which actually some people don't want. So that can be a challenge if someone's got a bigger breast and wants a less natural result. Can be difficult in my hands. Precious Tyra, I am in Birmingham. Can I come over? What, for a book? You can come over a book, Precious, or a consultation. Yeah, you can, Precious. Pop in. 50 Frederick Road we are. Absolutely. Kimberly, JJ, would I be able to book an appointment with you, please? Kimberly, of course you can. You're a patient. Yeah. Have you not gotten a patient? I haven't seen you in ages, Kimberly. Give us a ring, email or something. Or yeah, of course you can. I'll try and remember to talk to them tomorrow to ring you. Definitely, Kimberly. I hope you're all right. Yeah, of course you can. OMG, this surgeon pretending to be a professional and killing people like that. Imagine Jesus Christ. Yeah. I wouldn't go. Yeah, I don't think killing any Precious. I mean, I don't think he meant to kill her. Sounds bad, doesn't it? Kill her. But you know, it was a big op she was having. But yeah. Anyway, hashtag AskJJ. Terry, Tracy, and Terry. Tracy straight to the top of the class. Terry second in command, using the appropriate hashtag. How much fat will you take out during lipo combined with a tummy tuck? Does this depend on safety, how much fat or other things? Well, I mean, up to a certain level, it depends on safety, but it mainly depends on how much fat you got there, Terry. And in my hands, I try and avoid doing this sort of stuff on people who are overweight. So I try not to have patients who've got loads and loads of fat to remove. So my normal amount of fat during a tummy tuck, I normally take it out of the sides it's normally 1 to 1.5 liters is where I am at with it. So I'm normally in that range. Now, in terms of when you talk about safety, that normally you're looking at over 5 liters really when you get into the realms of potential fluid shifts and people feeling weak and wobbly and collapsing and stuff, and you need to be on a drip overnight and things. If you're doing more than 5 liters, I think generally more than 5 liters is considered a large amount of liposuction. So I'm well within that, and my 1 to 1.5. I probably have gone over 2 liters, but I can't remember. I don't really go anywhere close to 5 liters in my hands, because I try and operate on people who aren't overweight and haven't got huge amounts of fat they've lost. In my view, cosmetic surgery, plastic surgery is really good for people who've lost weight, who just want to be contoured. It's not a weight loss thing. It's not like I'm going to win the lottery and have lipo. No, it's not a weight loss thing. So yes, it depends on safety if you're overweight, but try and get your weight right first. Jess Grantham is here. Hey, hope you are well. I am, and I hope you are well too. Thanks, I know where you are. I came before. There you go, precious. Well, come again. Amy, or no, I'm late. Amy, you've done a comment on Instagram, on YouTube. So, big up yourself. You haven't missed anything, Amy. Terry, thank you. Terry's in Red Ruth, by the way. So you're welcome, Terry. Where are we up to? What are the risks of my makeover? Done that. Can you advise the implant brand you use, warranty and lifespan? In addition, I'd like to know if you insert the implant under the pectoral muscle. Right. Well, in terms of implant brand, I am not tied to any implant brand. So if you want any sort of particular implant brand, as long as the hospital can get it, I'm fine with it. And I've used many of them, probably not all of them, but I've used many brands. So I'm okay with them all, and it all goes on dimensions, and they're all sort of similar in terms of their dimensions. If you don't have a view on the brand, I tend to use Polytech. The reason I use Polytech is Polytech are the only brand for polyurethane implants. So if you want polyurethane implants, you've got to have Polytech. They're the only company that make them. If you want silicone implants, there are different. Polytech also do silicone implants. There are Nagor. Sometimes I used to often use mainly Nagor, but I still do use Nagor. Mentor, Motiva. Motiva make the micro textured one, but again, Polytech also make a micro textured one. So bottom line is I'm not strictly tied to anyone. If I had to say one, I'd say Polytech, for particularly polyurethanes, it's the only one. Silicone, Polytech, and Nagor, I guess, are the go-tos. But yeah, if you've got a view on it and you want a certain make, then as long as the hospital can get it, that's fine. I'll find the dimensions to be similar, and it's quite nice. Just I don't use the make that I use because I think they're the best. I think they are good, and I think they've got a very good warranty. I think the warranty is the main thing about them. They're excellent warranty, but it's just because I'm familiar with them. I've used them for a long time and I'm familiar with them. So I wouldn't say that another implant isn't good. I think they're all, all the main manufacturers are good, and I'm comfortable using all of the main manufacturers. And I'm always a bit worried when people come to the clinic and say, I've heard this makes best. I'm like, well, not necessarily say they're best. They're fine. They're good. It's not like they're not good, but I'd be wary about anyone who tries to tell you this is the best make, because we all use it if it was the best make. So I think they're all, they're all pretty good. Terry says, thank you. M&A, hashtag ask JJ, followed by sorry. You don't have to say sorry, M&A. You used the hashtag ask JJ. Come on. Sorry if you've been asked before, but do you use drains for tummy tucks? Don't say sorry, M&A. It's fine. Yeah, ask questions. I do, M&A. I do. As a general rule, we're moving away from drains. Tummy tucks is one of those ones I still do use it. Now I am quilting with my tummy tucks now, and I'm getting a lot less drainage, but I still can't bring myself to make the leap. When they first started doing tummy tucks without drains, a lot of people were using the glue, and I didn't really feel comfortable with that because I felt that could shear quite easily, and it had a seroma rate. I think quilting is better. So sort of closing down that space with quilting stitches, but I'm quilting and using drains. And it's a natural thing, and I might stop using drains maybe for smaller tummy tucks, but at the moment I am using them and I know that no one likes them, but I like the fact that they're suction drains. They suck the space down closed, and I like that. But yeah, that's where I am. But I reserve the right to maybe change my practice because I know the movement is going away from them. But at the moment I'm still there. Hashtag Ask JJ Tracy. Come on, look at this. Tracy's done 2 hashtag Ask JJs. Huh? What about the rest of you? What are you playing at? Tracy's done 2. What have you done? What have you done? Hey, Tracy's done 2 hashtag Ask JJs. I mean, she's on fire tonight, Tracy. Hashtag Ask JJ. How long does swelling last for after a tummy tucking? What? That's a quality question. Nice one, Tracy. Depends a little bit if you have the lipo, Tracy. So if you're having lipo to the sides, more swelling. Lipo is quite a swelling procedure to do. Get quite a lot of swelling. Not quite sure what the appropriate English should be, but we're not here for English, guys. We're here for facts. All right. So if he gets the English a bit wrong, cut him some slack. Yeah. So lipo is quite a swellogenic procedure. So there's quite a lot of swelling with the lipo. Tummy tuck also, yeah, I guess tummy tuck there is swelling as well. I normally say, Tracy, that bruising week or so, swelling normally starts to settle at about 3 months. You heard me, 3 months for it to start to settle. It's a long time, and it can take 6, 12, or 18 months for it to settle. I've got to be honest with you, Tracy. That's if you ask me about like a breast reduction or whatever, or breast implants, I'd say the same. It does take a long time for the tissues to get over what you've done to them because it is quite traumatic doing this sort of stuff. So about 3 months, you get an idea where you're going to be, but it can take, longer than that for it to fully settle. You're funny. There we go. Funny. I'll take that, Tracy. Thank you. And not only that, hashtag Ask JJ. You're funny. It wasn't even a question; it was a statement. But thank you, Tracy. Terry is in the house. Terry, lovely to see you tonight. Do you use drains for breast uplift with implants? No, Terry, I don't. So the only got to think I'm making a factual statement here. The only surgeries that I use drains for are tummy tuck, capsulectomy. So if you've got to remove the capsule, might be relevant for you, Terry. If you've got to remove the capsule, then I do, because a capsulectomy is quite traumatic. So for a capsulectomy, I used drains, and for bigger breast reductions, I use drains. So it's just those 3 operations: tummy tuck, capsulectomy, and bigger breast reductions. Smaller breast reductions, I don't. Breast lift with implants, I don't. Breast implants and breast lifts, I don't. So, but for capsulectomies, I do, because it is quite raw surface when you do a capsulectomy. Tracy's gone for, I'm thinking that's the 4th hashtag Ask JJ. Yes, Terry, that is yes. Yes, but Terry, don't worry. Drains aren't bad. They're not that bad. They're just a bit uncomfortable. Don't worry. Be okay. Tracy, hashtag Ask JJ. I swell lows after I eat like I'm going to burst. That's different, Tracy. That's intra-abdominal. So the swelling we're talking about is extra-abdominal in the tissues where you've done the tummy tuck. So that will still happen if you sort of bloating, basically. If you bloat, you will still bloat after a tummy tuck. So that's intra-abdominal swelling. So that'll still occur after a tummy tuck. Do our prices cover for lifetime? And if I need change implants spelled wrong, in 10 years time, I will have to pay again. I think it means will I have to pay again? So do our prices cover for lifetime? And if I need to, so yeah, this is a good question, because this comes to what does the warranty cover? So lifetime, you can come back to clinic. You can come back to clinic as often as you want. If you've got a problem, you can come back to clinic at any time. But if you need to change your implants, and depending on why you, so the implants have a warranty with them. A lot of them are covered for they're pretty much all covered for rupture. Some are covered for capsular contracture. So if you change your implants, you can get another set of implants. But if you but you will have to pay for the surgery. So if you need to have your implants changed in 10 years' time, depending on which implants you have and whether if you're going to change to the same set of implants, you might be covered for the implants. So they might give you a new set of implants, but you won't be covered for the surgery. And if you want to change to a different type of implant, you would have to pay for this implants. So yes, you would have to pay if you need your implants changed in 10 years. And I know it's bad, and I have been looking into for many years some kind of insurance policy thing that you can pay, you know, whatever, and we cover you for this, because I think a lot of people worry about this, changing implants in 10 years, because it's expensive. It's more expensive than the first operation, especially if you need a capsulectomy. So it is expensive. So but at the moment we haven't got one. I don't know if I can do it myself. I don't think I can do it myself, can I? Because I know my numbers, and I could probably do it myself and say, look, you pay this much. But I think I probably need some kind of, you know, Lloyd's of London type thing. But we spoke to insurance brokers before years ago, probably 2 or 3 years ago. But obviously, I don't think they like doing it. I don't know. Anyway, they don't. There's no one I know that offer any sort of insurance. So bottom line, yeah, if lifetime for coming to clinic, but if you have the implants changed, you'll need to pay again, unfortunately. What's Terry? Yeah, Terry looks frightened. Oh no, I had one pulled out my tummy and that hurt me. I know, Terry. I know. They can be a bit uncomfortable, but that might have been deep in your tummy, Terry, whereas this is superficial, so it might not hurt as much. Let's manifest. Let's be positive. What is the recovery time for Pinnaplasty? So Pinnaplasty is changing the shape of the ears, prominent ear correction. So Pinnaplasty, I don't do it, but Kuram does it at the clinic, and it involves a head bandage or a headband. The head bandage is usually on for a week, and then the headband's on at night time for a month. After that, I think normally, I don't know what Kuram's policy protocol is, but again, they're battered and bruised and swollen. They are quite swollen and bruised for a good few weeks. And again, it's going to take a couple of months before that swelling starts to settle. So again, don't make any long-term decisions about it for a couple of months. But having said that, once the bruising goes off the first week or so, you can get away with a bit of swelling because your ears often not visible. You know, both ears aren't visible. So, you know, you can get away with that swelling, and hopefully it won't be too obvious. Do we offer earfold technique? No, we used to. Earfold's a little metal clip. Oh, hold on a minute. The next question is talking about earfold. So no is the answer to that. We used to, because we had Mark Lloyd who could do the earfold. I think there's only I think you have to do a course or something to do the earfold, and there's only a certain few surgeons. So Mark Lloyd specialised in ears, and he done the course, and so he was going to do the earfold at the clinic. And so we, you know, so great, and we did a Facebook Live joint Facebook Live where we talked about the earfold and everything. But then Mark went off and wants to base his practice in London and stuff, and doesn't work at the clinic anymore, basically. So we don't offer the earfold. And I know what your next question is going to be because I've got it here. What is the difference between earfold and Pinnaplasty? So as I say, earfold, what I was about to say, is a little metal clip that goes in. And the great thing about earfold is it's much less invasive than a Pinnaplasty. Just a little incision, a little metal clip that goes on this part of the ear here, which is called the antihelical fold, this fold here, to recreate that fold. So if you have got that fold, it recreates that fold. So it's a great concept, and it's the benefit of it is it's much less invasive. What we do is the traditional Pinnaplasty, which involves incision behind the ear and reshaping the cartilage. Now, you can do a lot more. You can do a lot more work when you do a Pinnaplasty, and it can correct a lot more problems than an earfold can, because an earfold just really recreates the antihelical fold. Now, I'm not saying the ear fold's bad, but it's limited in its indications. But in the right indications, it's good. But unfortunately, we don't do it. But a pinoplasty, you can do everything that you can do with an ear fold with a pinoplasty and more. The downside of a pinoplasty is it's more invasive because there's a scar behind the ear and it's a bigger operation. But an ear fold is a metal clip, so you could argue that it's a foreign body, and if there's any failure of the clip, then the cartilage can spring back, whereas a pinoplasty reshapes the cartilage permanently. But so there's pros and cons of both of them, but I do think the ear fold has a place, which is why we were talking about it with Mark. But as I say, we don't offer it. We offer pinoplasty, and we can treat mild, moderate, severe prominent ears with a pinoplasty. You can treat everyone with a pinoplasty, whereas an ear fold you can only treat people with just a localized problem with the antihelical fold. Tracy, do you want a fifth hashtag? Yes, I do, Tracy. Hashtag ask JJ, how long does bruising last with fat transfer into the butt? Now, Tracy, I will tell you how long fat bruising lasts after fat transfer, full stop, because I don't do fat transfer into the butt. And we've actually talked about this recently. None of us, we've been told we're not supposed to do it. I never did it, to be honest with you, because it's got quite a high complication rate. So plastic surgeons in the UK have been encouraged not to do it. At least members of BARPS, BAAPS, have been encouraged not to do it because of the complications with it. But in general terms, fat transfer can have a bit of bruising. I'm going to say a week or two, Tracy. Swelling for a couple of months, but a week or two for the bruising. Hopefully it's not too bad. But as I say, I don't have experience with the butt specifically. Number 6, hashtag ask JJ. Tracy, you've gone a bit crazy now. Hashtag ask JJ, when can you start exercising, i.e. sit-ups and the plank after a tummy tuck, please? Again, Tracy, depends on your surgeon. Am I a surgeon? I don't know. If I'm your surgeon, I'll answer the question. If I'm not your surgeon, don't listen to what I'm about to say and do what your surgeon says. 6 weeks, I say starting doing activities with your core, but gently. I mean, gently. Sit-ups and planks quite extreme. So gentle after 6 weeks. And again, you might not feel up to it, in which case, don't do it. Don't just say do it because I said you could do it. Listen to your body. If it feels uncomfortable at 6 weeks, don't do it. If it hurts and swells, don't do it. But you can start thinking about it at 6 weeks and then gradually building up. And again, it's about 3 months before things start to feel normal and stuff, but you can start thinking about it and gently getting into it after about 6 weeks, in my view. But as I say, surgeons are different on that one. But yeah, listen to your body, Tracy. That's the answer. That's the answer for all this sort of how long can I do this. Listen to your body. If it hurts, if it swells, stop. Is inverted nipple correction included in BBA? No, it is not. Now, it can be done. Often people say, can it be done during a BBA? So this is a different slant on that. So it can be done with a BBA, BBA being bilateral breast augmentation. So it can be done with a breast augmentation, but it is not included. It's a different procedure where we make an incision of the nipple and bring the nipple out. Now, the reason this is an interesting question, or the question is often asked, is with breast lifts and breast reductions. So with breast lifts and breast reductions, because you're moving the nipple, you worry, or I worry, about the vascularity in the nipple. So I tend not to correct an inverted nipple at the time of a breast lift or a breast reduction. I would do it later on, but it can be corrected at the time of a breast augmentation, although it is not included. It would be an extra. Sadly, you wasn't my surgeon, but will be next time. I'm for moths post-TT, post-op. Well, good on you, Tracy. And see how, I mean, again, talk to your surgeon. But yeah, I mean, I would have thought you could start getting a bit of core activities going on there, in my view, as long as you're feeling okay. But I don't want to get in trouble with your surgeon, so you better do what your surgeon says. Where are we up to? What cup size? Oh, hold on a minute. Sorry. Terry's asked a question. How long have you got to keep the drains in for? Terry, most of the time, overnight is okay. It depends on how much is in the drains, though. So sometimes 2 nights. You don't go home with the drains, Terry. And this counts for tummy tucks, breast lifts, tummy tucks, capsulectomies, and larger breast reductions. All the opposite I do drains with. You don't go home with the drains. Often it's overnight, but sometimes it's 2 nights, and that will keep you in. So if it is 2 nights, that keeps you in. You don't go home with the drain. We take the drains out before you go home. What cup size is classed as an extra large BBR price? Now, Amy's put this question on, and I've told her not to say extra large BBI price because I don't think that sounds very good. I don't know what you think, but I don't think it sounds good saying extra, extra large BBR. BBR is bilateral breast reduction. I don't know if that's a standard thing, but the problem, not the problem, but we often say from, which always sounds a bit used car salesman when you say the price is from, doesn't it? So the thing about breast reduction, there are 2 prices, and because there are different, a larger breast reduction is significantly different from a smaller breast reduction. It's a lot more of an operation with a lot more involved, and it's up to the surgeon as to whether we class it as a large or a small. And it depends on 2 things really. It depends on the distance the nipple has to move. So what we call the transposition. So we measure the position of the nipple now, and we get an idea how far we want them, where we want the nipple to be. So the longer the transposition, the more risk. The longer that pedicle, the more risks of complications, and the volume to be removed. So it's not purely only on cup size. So it's not like this cup size equals extra large price. And I've got to be honest with you, cup size is not a precise science anyway, so I wouldn't do it that way anyway. But it's the cup size, or at least the size of it. It's not even the cup size actually. So cup size is not even there. It's the size of the breast and the transposition. So it is possible to have a very large breast with not that big a transposition. So that might be classified as large. And it's also possible to have a breast with actually not a huge amount of volume, but a very long transposition, and that would be classified as large. So it's not a set thing that you can know before you come to clinic, basically. I mean, we can give you an idea if you send us photos and things like that, and give us an idea of cups that you're wearing. But really, we need to see you in clinic. That's why the price is from. But if you're uncomfortable, or if we haven't helped you, I always say, look, we'll give you the consultation feedback, because we don't want to be these people that say, the price is this, and then we tell you the price is more and you get cheesed off. So if there's any issues like that, we'll give you the consultation feedback, because I don't want to be like, I think what people often think plastic surgery is like they're sort of trying to get your money and trying to hoodwink you, because I don't like that. But we do have the from word there, which probably looks a bit hoodwinky, but it's not hoodwinky. It's just because, some breast reductions are bigger than others. I've just had my gallbladder removed, so have to wait again. Yes, do have to wait. Yeah, good. Hi, Jonathan. Donna here. Hi, Donna. Donna is confusing by being on Neil's account, but it is Donna. Hi, Donna. Good to see you here tonight. We got some cracky Tracy's. Terry's done a funny emoji. I don't know if that means she's shocked at how long the drains are in. It's not that bad, Terry. 1 night or 2 nights. Do we carry? We're coming to the end game here, Donna. End game. Do we carry out facelift procedures? No. No. You know what? I think Kurum does them, but he doesn't do them at the clinic. And I think one of the things about the way I've done the clinic is, obviously I'm involved. Well, obviously, this is my clinic. And, I don't do facelifts. So it's hard for me to help if, there's issues or questions and stuff, if people inquire about facelifts and things like that, because I don't really do them. So we decided, look, we're not going to do facelifts. So we do breast and body, really. Anything breast and body, this guy's clinic is your place to go. Faces, as I say, Kurum does ears, obviously moles and things for the faces, but rhinoplasties, nose jobs, facelifts, stuff like that, we don't do them. Sorry to disappoint, but there's good guys out there. I think Kurum does them in other hospitals. I normally say to people, Hiroshi Nishikawa at Westbourne Centre, very well respected surgeon in the region. Fazal Fattar, don't know if he's still operating. He's also at the Westbourne Centre, excellent surgeon. So there's lots of good facelift guys out there. Terry's worried. Terry, I know you're worried. I think you'd be worried whatever, Terry. You got to start manifesting and start, don't worry, don't worry. The drain's the least of your worries. Last question. Healing time for earlobe repair. So it's not too bad earlobe repair, to be honest with you. Dissolvable suture, local anesthetic, in and out, same day. Can do it on the day of the consultation with a bit of notice. Dissolvable sutures in there. Personally, I use dissolvable sutures. Bit of ointment like 2 or 3 times a day for a week or so. Tiny little tube, just until the tube finishes. Week or two, stitches will fall out. Scar will be a bit red. You'd expect that skin to be healed in about 4 days. So 4 to 7 days. In the first week, the skin will be healed. You can wash and shower straight away. So washing and shower straight away. Scars healed in a week or so. Be red and obvious. I'll catch up with you about 6 weeks, get you massaging it. It takes a few months for the redness to fade. It feels firm, feels hard. So it takes months for it all to fade and the scar to fade and everything. But in terms of healing time, you know, you could go to work same day. Maybe nice to have a day off, I guess. But next day you go to work, if you don't mind having stitches in your ear, little white stitch. Well, they'll probably be red because they are white, but they get a bit of blood on them. But yeah, the healing's not bad at all. As I say, it'll be healed in a week, but you wash, shower, there's no dressing or anything on it, just put ointment on it. So it's pretty good, the healing for an earlobe repair. It's pretty low maintenance. You can do stuff like exercise, things like that. You know, it's fine because you're not going to do any harm to it. So the healing time for earlobe repair is not too bad at all. So I am out of questions. I'm very much hoping there is a toad in the hole waiting for me. I hope so, because I'm, you know, hard-working guy here, and I did put an order in earlier before I came on, but who knows? If there's no other questions, I will be right here, 7 o'clock next Tuesday. I don't think I'm away. No, yeah, next Tuesday. Awesome interaction. Very lovely Amine and Amy on YouTube. Big shout out to you YouTubers out there. Facebook's been fantastic. Instagram's been lovely. Jackie, honestly, Jackie is the first one on the dance floor and the last one to leave. Terry's been worried, but Terry, please don't worry, for goodness sake. That is nothing to worry about the drains. You've got enough on your plate. Just don't worry about the drains. And I'm going to declare myself out, and I'm very much looking forward to seeing you all next Tuesday night. Good night. God bless. Who says that? Good night. God bless. Terry, come on, have a word with yourself. Get there. Get positive. And also, Kimberly. I've got to remember, Kimberly, we've got to phone you tomorrow to get you booked into the clinic because I haven't seen you in a while. Got so much on, you know, busy guy. Right, let's put the X on. X on Valdez. There we go. Share. Cancel.